Hello, everyone. Thank you for joining this live stream right now. I am reporter Miranda Christian, and today we are going to be talking about this new COVID-19 variant that has been found in the UK. So far, it's forced 40 countries to block travel into the UK. It has been found 70% more contagious, and 60% of cases in the UK right now have this new variant. I'm joined by an infectious disease doctor. We'll go ahead and bring him in. And doctor, do you mind introducing yourself?
Hi, I'm Dr. Ramprasad Gopalan. I'm an infectious disease specialist.
And let's just dive right into this right now. What are you seeing with this variant that was found in the UK?
Well, in this country, the implications are minimal yet. The understatement, yet. The issue with this variant is still a lot of unknowns. Okay. Well, to give you a preamble to this virus technically does mutate every 2 weeks. Okay. And there are plenty of mutations. The reason why this is so, some of them are significant is what they acquire with this mutation. The 70% more effective transmission or more contagiousness is, it's not a true number. I think it is prevalent in that population. This virus is the most prevalent species which is found these days.
And of course, anyone tuning in right now, ask your questions. Please let us know what you're wondering, what you would like to know about this new variant. And I guess, one of my big questions is, why do you think it's only in the UK right now? I know there's been maybe some findings in South Africa and a few other countries, but why only in the UK and not here and not in China or some of these other larger places with high numbers?
Well, the South African virus you talked about has an exact similar mutation, but they've concluded those two are not similar. Well, we can never say it's not here. The reason being, we only have done sequencing in only like 51,000 of the 17 million cases here. The travel as we are doing right this minute, there are plenty of flights from UK to here. Possibly it's here. We just don't know. And what are the implications? We don't know.
Should the US be doing more sequencing to find out if it's here?
I think the new initiative from the CDC is that to do much, more surveillance, more sequencing, and then they're asking all the states and every single lab to send them, I think, 2 weekly samples to do sequencing. Yes, the clear answer is yes, we should be doing more.
And we got a viewer question here from Julie, of course, asking something that is probably on everyone's mind as this vaccine is rolling out. Will this be effective against this strain of mutation, be effective against the current vaccine?
The straight answer to that is we don't know. But the scientific answer is the vaccine is directed at polyclonal. That means it is not targeted at one area of the spike protein, which attaches to the human receptor. So since it is more areas are targeted in the vaccine, it has to acquire multiple mutations and to be making this vaccine rendered ineffective. So far the real answer is we don't know, but in reality possibly not, because of how it is.
It's not mutated too much quite yet that the vaccine wouldn't be ineffective so far with what you're seeing.
Correct. It has to mutate and retain that mutation, acquire another mutation, so that all the areas what we have targeted are like polyclonal areas we've targeted. If it acquires ability to counter all that, at that point we are in real trouble. We need to find a new one. But at this point, I think a strict infection control measures, and like every other country is doing, like putting a real rigid stop to propagation of this, will have us back.
And does the mutated strain cause the same symptoms? Again, from Julie. And I know something with this that I find what made this concerning is it is also 70% more contagious maybe this is a double question here, but how is it more contagious, and is it essentially the same virus then?
The 70% more contagious thing, it was taken out of context. Probably what it said was, the predominant strain in that population is this, around 60 to 70% at this point. I mean, even that's a different number. But the true science, how it does is it binds very strongly to a receptor called angiotensin 2 receptor than the original strain. The science has not yet proven whether this this binding has any real scientific meaning. Like, how does it translate into infectiousness? Transmissibility from one to other is still under investigation.
I know, in your opinion, is this something to worry about as far as impacting how we react to COVID, treat COVID? I know one of the things I read in almost every single article I read is so far it has not been found to be more deadly. Is that a good sign? Or in your opinion, is this how we should be reacting to this news? Or how should things be going?
Well, as this new strain, still there are a lot of unknowns. We have to proceed with extreme caution. Trying not to acquire that here and make that a predominant strain should be our goal. The treatments so far have not changed, and right now what we have itself is, most of them are experimental. So unless something new we develop towards this virus is named aptly COVID 2020-1201. So we don't want COVID 20 amongst us. So that's what we have to worry about.
So is this technically still COVID-19, or is it a different strain, or how does that work?
It's named COVID 2020-1201.
Gotcha.
So it's COVID 20 officially. Here you go. We have COVID 20.
That's terrifying to think of, but it sounds like it's very, very similar to what COVID-19 does so far and what the UK's seen.
Correct. I mean, the disease manifestations are same. The way it attaches to the receptor more avidly or tightly than the COVID-1 is known. But how does that translate to human disease manifestation is yet to be elucidated. But we have to be concerned now. If this strain is the most predominant strain in one community, that means it is spreading, it is suppressing the other. It has some biologic advantage, some genetic advantage. It is taking some kind of advantage to become the sole, virus in that group. So the science may be behind in finding out what that is. So we shouldn't be lacking in our resources and our effort to contain this. The containment for this, whether it's COVID 20, 21, or 19, is still the same. Wearing mask, social distancing still is the work to do even for this new virus.
Is this a surprise at all that this happened? You mentioned right in your my first question to you is it's mutating every 2 weeks. Is this a surprise that we got to this sort of variant?
No, I mean, every virus, tend to do this with the intention of getting a survival advantage on its own. So it is not specific just for SARS-CoV-2. So it is not surprising that these virus, is doing what it is doing. So if we contain this, so we can prevent much more mutations and giving it a genetic or biologic advantage to harm us.
Why do you think this is in the national news? Why is this making national headlines?
Because we have to, since there was a time when we let this go and it resulted in what we have today. So I guess people are very cautious, and since there are a lot of unknowns, and there is in a so-called advanced developed nation, we are seeing this kind of spread. So before we know what it is and why this is predominant species and what kind of impact it has. And I am sure it is, here or in many different places, because if you ever see the travel between UK is a hub, not only people going into UK, but how many times we have traveled, and then you have Heathrow as your stopover, layover. And if this is an efficient spread virus, and a worker in the say a concession stand over there can give it to you, and next thing you know, you're on your way down to your destination and you have it. So aptly, many countries have placed restriction on people transiting or coming from UK. So they are having strict quarantine. I mean, I know it is tough, especially during the time of holidays, but listen, we have to see next Christmas and Christmases beyond. So this is one of the tough choices we have to make.
And of course, going into the holidays, a lot of people could be getting together this weekend over the next 2 weeks here. Do you think right now there should be any new efforts to stop travel in the US or stop travel internationally with this, or is it too soon to tell?
Well, stopping travel may be an extreme, in certain situation, but very cautious approach, like most of the countries are doing. You have to place people who have traveled through UK in strict quarantine for 14 days, at least minimum, like everybody else is doing, and having a surveillance of these people who are coming in, and then making a really conscious effort to make sure that they are not getting sick. And the problem is this virus, you may not be sick, but you're still contagious. So their contacts around them, if they ever get sick, so testing them and sequencing them to find out if they have the new COVID-20 uh, should be what we should be doing, rather than putting a big wall against travel. A concern and a concerted effort to mitigate the transmission should be done.
Essentially, if you do what you're supposed to do, which is the mask, the social distance, test yourself if you're worried, that's where we can control the COVID-19 spread and this new spread.
Correct. And then stop all non-essential travel. If you're coming here to visit your old grandparents, wait. I mean, if it is not imminent, you're not coming here for something really emergent. If it is a pleasure trip, stop. You know what? There are plenty more years to do that. And just not do that kind of non-essential travel. And that will be the good for the world at large.
We got another question here from Jane. If the virus is mutating every 2 weeks, how is the vaccine supposed to be effective? I know you kind of touched on this more, but this is a great question that a lot of people may not understand how this vaccine is very different from others.
Correct. In simple terms, what mutation means is that some part of the genetic material changes. That doesn't mean it has acquired a new way of transmission. That doesn't mean it has acquired any more what do you call virulent. Okay, simple thing. It doesn't become any deadlier, more infectious, or anything. It acquired the current virus with a point mutation has acquired a way. What we know is binding to the receptor protein. That means binding to the place where it attaches to our body itself to get inside. It binds strongly. Does it mean it causes a worse infection than the regular COVID-19? We don't know that yet. So having mutations every 2 weeks should not be a concern, because that's what it tries to do. Again, the vaccine, what we have, is effective, and because it does target many areas of the spike protein, not just one. But the problem would be to something called monoclonal approaches, where if it has a mutation in that particular area where we are targeting, we may have a problem. But right now, we don't have any concern in that regard. So the vaccine is still effective. And please, once it comes to population at large, please do go ahead and get it.
What's it? Oh, we got another question here from SJ. When they test someone for COVID, this is a great question. How will they be able to tell the difference from COVID-19 and this COVID-20?
There's no difference. It's we test. The current test targets multiple areas of that virus. It is just one mutation of that, but the virus and the genome is still the same. So it detects both 20 and 21. The problem becomes when it acquires multiple things and the current tests become invalid to detect this particular strain. I don't think we are there yet.
What's it like just watching kind of science unfold in real time? I know that's been a big talk this past year as scientists are learning this virus in real time. What's it been like for you as an infectious disease doctor, kind of watching this and watching everything come out? How have you been able to adapt and kind of talk to people and explain things as we learn day by day?
Correct. This is a disease where approaches, treatment have changed as we moved along. What we did in the first case, we started off here in February and March, well, how we treated, how we learned along the way, like what are the modalities that changed the survival of patients. We learned more about the virus, we learned more about the treatment, we learned more about how we can treat effectively patients. And also there's a global community. I mean, I personally keep in touch with many different parts of this world, and then colleagues from different countries, and things are propagating pretty well. The information dissemination, thanks to our current technology, we can get information out in an instant. Unlike in the past, we have to wait for the journal to appear. So this is how we are dealing with this virus at the current time. And also, there were a lot of questions about children. I see on the thing, there is no studies which says that this is it's worse for children versus others. I have not seen, not has this been elucidated. So I think still the same precautions, what we're doing for 19 holds very true for 20.
And another question here from Karen. If the RNA is coding to the cell to think it's the virus, but the virus has no name, so what is the body fighting? Will it fight against its own cells? This sounds like it's a little bit more about the vaccine.
Very simple thing. What the mRNA is, messenger RNA, I'll just break it down. Everything our body nucleus sends a message to make different things in our body. That's how it's very ingenious process how the cell works. It's fascinating. Now, what it is encoding is for a portion of the protein, the spike protein, which is binding onto our cell to get in and then attack us. It is targeting multiple areas of that spike protein. That's called polyclonal. So when this messenger RNA translates and makes that protein, not the whole virus, just that protein, body is seeing that protein and it knows it is foreign, and body fights that. It is not its own body. It is a foreign body, that spike protein. So it makes an antibody against that. So if when the real deal comes in, it knows that's what it is, and it will fight the real infection or the virus when it comes in.
And kind of my last question for you here is, we'll kind of loop back to one of the very first things you said is, should our country be concerned about this mutation? Should people be fearful? I know there's been a lot of fear in people throughout this whole thing. Is this something to be worried about in the US?
Well, concern and fear are two different things. Concern, absolutely. We should be concerned very much. And the way we should mitigate this is by simple epidemiological tools, which we have been following since, the invention of modern science. But now, should we curtail travel? Yes. You should ban all non-essential travel to this country from the known areas, what we already know. But having said that, has it, been here? I presume, it is. But again, the proof, none, because we haven't done that much of genetic sequencing to figure out that it is here or not. Just by going by deduction, the travel from UK to here are so much. So be cautious as if it is here. Please wear mask, wash your hands, do the safe distancing, what you are doing, and don't get fatigued by this as saying, I've been doing this for so long, I think I'm good, I'll do it. Because look, there are new things coming. We need to be prepared. And having less fun in one holiday, please, there is no fear for this virus. Be prepared. Fear, we don't fear for nothing. Fear will not get us anywhere. Being prepared, as this great nation is. So we have dealt with many things. We will deal with this one too. But don't go under the political divide of right, left, center for this mask and everything. This is a scientific issue. Just listen to the scientists, listen to yourself, protect yourself and your family. And please put your mask, keep safe distancing. And when you're enjoying your holidays, still follow guidelines. You know what? There are plenty more holidays to come, and we can do it safely.
Thank you. Thank you so much. I hope you saw that message from Karen there saying thank you to you, doctor. And thank you so much for joining us today and giving your expertise on this issue and taking time out of your day. We appreciate it so much. Thank you to everyone for joining and asking your questions. Of course, you continue to follow the story on our website at WPTV.com. Thank you guys so much.
Thank you.